Good afternoon. Director of Public Health and Community Services Bobby Bagley and I are here to give you our weekly update on the status of our fight against the coronavirus here in Nashua. Let me start by saying I know this has been difficult for you, for all of us. It often gets frustrating and a little depressing that we have to stay at home, that we need to wear masks. Why do we have to do this? But keep in mind that this is something very important that we're working on together. It's not easy, but we're working on it together, and we are making progress, definitely making progress in containing the spread of the virus. This is a virus that, particularly with our seniors, it can kill, it can be fatal, even with younger people. We know people still who are in the hospital on ventilators. So our fight isn't over, but we're definitely containing the spread through these not so easy measures that we're taking: staying at home, wearing the masks, the social distancing, closing various businesses for a period of time. But today we're going to go through some of the statistics and give you some of the facts and information about where we are in Nashua and also in our state of New Hampshire. So right now, I'm going to show you our first slide. It just gives you an overview, things you've probably already seen. Worldwide, there's 6.4 million cases, 1.8 million cases here in the United States. The deaths in the United States, the highest in the world, 106,000. Just shows you how deadly this disease can be. Here in New Hampshire, we've had 4,700 cases. Most people have recovered. 10% or so have been hospitalized, and about 5% tragically have died. This is over 200 people. If we go to our next slide, in Nashua, we've had 492 cases. That's a cumulative number. Most of those people have recovered. Unfortunately, again, tragically, 14 people right here in our community have died from COVID-19. We have 122 active cases, and you see on the slide that it says contacts 170. What that means is that our Bobby Bagley and our public health department, our public health nurses, are working with every person who is tested positive. They determine who that positive patient, positive for COVID-19, has had contact with in the days before they became symptomatic, before they developed symptoms. And then they reach out to all those contacts and they talk through their situation, tell them that they've had contact with someone who's tested positive, instruct them to remain at home, to quarantine, and help them get a test so that it can be determined whether they have the virus. But the point is to limit their exposure to other people in case they have contracted the virus and might spread it to someone else. This is called contact tracing. It's being done every day right now with 170 people by our public health nurses. They're working 7 days a week on this. This is one of the main activities that contains the spread of the virus and helps keep us safe. So I want to thank our public health nurses and all of our healthcare workers at the hospitals, medical offices, across the community who are working so hard on behalf of all of our residents. Now, our next slide shows you some of the information that is being developed. The slide is the new cases per day. This is for Nashua only. It just shows you that there's been a couple of spikes, but generally speaking, we're in a favorable path, a slightly downward trend. But Nashua is a small sample, so it's really more important to look at the entire state of New Hampshire, which gives you a better snapshot of what's going on. But this shows you the number of cases per day. Most recently, it's around 10 or a little more or a little less. Now the next slide shows you the number of tests that have been done here in New Hampshire. Very, very important as well. We want to test as many people as we possibly can, not only to determine who has the virus and help treat people, patients that do test positive, but we also want to determine how widespread the virus has become. Very important in terms of looking to the future and trying to decide how to move forward in concert with our medical experts and our scientists who are studying the disease and determining how it spreads and how we should continue to fight it. So we see that in New Hampshire we've had almost 90,000 tests total. Testing is being done across the state, testing right here in Nashua. If anybody wants to get tested, the criteria for being tested have been broadened considerably because there are more tests available now, and really anybody who wants to get tested can get tested. And you should call if you believe that you would like to be tested or if you have symptoms. Call 589-3456, which is the public health COVID-19 hotline. The tests are by appointment on selective days during a week, and you can make an appointment that way. But also there are tests available elsewhere through some pharmacies, through your medical provider, your primary care physician. So there are various ways you can get tested now, and you can see that the number of tests started at a very low level, but is now up to 90,000 across New Hampshire. The next slide shows us the persons being monitored for COVID-19. This is the contact tracing that I talked about a couple of minutes ago. Across the state, like in Nashua, people who have had contact with a patient who has tested positive are worked with to make sure that they stay at home, to make sure that they isolate, to make sure that they do not spread the disease if they've caught it to anyone else before it's determined that they do not have the disease. And of course, if they do, then they are required or instructed to stay away from other people, stay at home, self-quarantine, unless their symptoms become so serious that they must go to the hospital. And about 10% of people who have contracted the COVID-19 virus, both in New Hampshire and in Nashua, about 10% have been hospitalized. And as I already said, unfortunately in Nashua, 14 of those people have died. So one thing that people I know are thinking a lot about is how do we reopen? How do we get back to something like normal? We don't know exactly what the future holds. We have to see how the disease evolves. We have to see if there's a second wave or a second surge as there's more social contact or as the weather gets cooler in the fall. Some coronaviruses do reemerge during the colder months. But we certainly are all very interested in how we're going to return to something like normal, or the new normal as some people call it, because again, this hasn't been easy. I know how difficult this has been, and it continues to be hard in various ways. For many people, including myself, it can be depressing and a little sad. You begin to wonder, is this really worth it? But again, we're doing something very important by working together. We're helping to save other members of our community, save family members and friends from potentially being infected and getting a serious case of COVID-19. So there's a three-phase approach towards what we call the regional gating criteria. These are the factors that the medical experts tell us that we should begin to look for. With respect to symptoms, there needs to be a downward trend of influenza-like illnesses reported over a 14-day period. And there needs to be also very similar criteria, a downward trajectory of COVID-19-like symptoms reported within a 14-day period. Number two, there has to be a downward trend in the documented cases, the proven cases of COVID-19 during a 14-day period. And the number of people who test positive, the percentage of people who test positive, needs to also be on a downward trend. Now, some weeks ago, about 10% of the people who were being tested in Nashua and in New Hampshire were testing positive. That number has declined so that it's more like 7 or 6% now. That is a good sign. And certainly at the hospitals, basically the two criteria suggest that testing is available at the hospitals and that they are not overwhelmed with patients, which is not they are not. They've been doing very well. We have periodic, almost daily calls with the hospitals, and right now there are more than 10 patients between Southern New Hampshire Medical Center and St. Joe's, but less than 20 and closer to 10. And that number has drifted up. Earlier was up around 20, but has come down a bit. So they are definitely not overwhelmed with cases. So we are certainly making progress with in terms of the gating criteria, the criteria we need to meet as we gradually reopen the economy. Now, of course, the reopening is under the control of the state of New Hampshire, principally through the governor's orders. The governor is the one who's determining when, for example, a restaurant can open now to outdoor seating but can't open indoors. And all of the guidelines which exist for various businesses, those are issued by the state of New Hampshire. And of course, we here in Nashua are following that guidance and working with them to make sure that the efforts are effective in terms of making sure that we do things the right way. So you recall that on the previous slide, one of the criteria was the percentage of positive tests is declining. And you can see here in this graph that in late April or so, we were getting more than 10% positive tests. More recently, as I said, it's somewhere in the 6 to 7% range. So as I mentioned, that is good. The bar graph shows you just the total number of positive tests, but the line shows that the percentage of people who test positive is going down. Another great gating criteria, which you recall from that previous slide, is the new COVID-19 cases per day. We are seeing a downward trend there. So, and you can see it from the blue line, which is state cases. You can see that in recent days, in the last couple of weeks, the number of new cases that are discovered every day is definitely on a downward trajectory. That is good. That is, again, a good sign. Here's another slide that basically shows the same thing. The number of new positive cases determined, people who test to have the virus, has been reduced by about 40%. So as we look at our next slide, it just gives you a sense of what the thinking is, the medical experts and the doctors think about, and the Center for Disease Control down in Atlanta, regarding how states should approach the reopening. So in phase 1 of reopening, there has to be a downward trajectory of new COVID or flu symptoms for 14 days. Now we have almost reached the 28-day period now, so there's been a downward trajectory for almost 28 days. So we've certainly achieved the 14 and are on the way to achieving 28. There has to be a downward trajectory of trajectory of the percent of tests that are positive. We've seen from the graphs that that's also the case here in New Hampshire. And the hospitals have to have testing, and they can treat all patients without being stressing their capacity, and that's been true for quite some time. In phase 1, all individuals, all vulnerable individuals are those that we know about, people who are over 60, our senior citizens, also people that have an underlying health problem, an immune deficiency syndrome of some kind, maybe they've got diabetes, maybe they've had cancer, something like that. Anybody with a serious health problem is at increased risk. So they, in phase 1, should definitely continue to stay at home. But when they do go out, they should maximize physical distance from others, at least 6 feet. They should avoid groups of more than 10 people. And this is, now we're talking about all individuals. Vulnerable individuals should stay home. Others should maximize physical distance, at least 6 feet. Everybody should avoid groups of more than 10 people. And certainly all non-essential travel should be dispensed with. Now, once we get through phase 1, then we move to phase 2. And right now in New Hampshire, we are close to entering phase 2, because once you've had the 14 days of a downward trajectory in terms of new cases and in terms of the percent positive, once you reach 14 days, you're in phase 1. When you reach double 14 days, you then enter phase 2, and we are very close to entering phase 2 now. So phase 2 occurs when there are states or regions with no evidence of a rebound, so no spiking up, and they satisfy the gating criteria for a second time, meaning for 28 days, not just 14, but 28 days, those downward trends continue. In phase 2, and again, we're very close to reaching that stage, all vulnerable individuals should continue to shelter in place. So vulnerable individuals, our seniors, people with an underlying health condition, need to continue to stay at home and be very careful. Again, all people should continue in phase 2 to maximize the distance, 6 feet, from others in public. But now, slightly larger groups of people could gather in phase 2, up to 50 people, as long as appropriate distancing is maintained. And certainly all precautionary measures should be followed. Non-essential travel can resume during phase 2. And I forgot to give you the phase 2 slide. There's first phase 2, and then here's what I was just going over. Again, vulnerable individuals in phase 2 should stay at home. Others should maximize physical distance. Groups can be a little larger, up to 50, as long as distancing is observed. And then, finally, non-essential travel can resume. You remember in phase 1, all non-essential travel should be avoided. Now, we reach phase, and we are, again, close to phase 2 here in New Hampshire. In phase 3, we reach that when for the third time, the gating criteria are met. So for a third time, for a series of 14 more days, we reach a downward trend in the terms of the number of new cases and the percentage of people who test positive. So we reach phase 3 when we meet those gating criteria for a third time. Once we reach phase 3, then vulnerable individuals can resume public interactions, but they should exercise physical distancing. They should minimize exposure. They should minimize exposure to social settings where distance may not be maintained. And low-risk populations, meaning people who are not particularly vulnerable, should consider minimizing time spent in crowded environments. So that's what we're working towards. We're working towards phase 3. We're close to phase 2, and the state of New Hampshire, the governor of New Hampshire, are looking at all this information in deciding how to gradually reopen the businesses across the state. So those are some of the things that we're watching. I want to let you know that people here in Nashua, public health and others, and I've mentioned this already, but they're working very hard all the time to take the steps necessary to contain the spread of the virus. I'm very proud of the team effort that has been undertaken. Also, many volunteers have been reaching out to help those in need, both working for our nonprofits as well as our nonprofit agencies as volunteers, as well as, for example, the effort to hand out masks to anyone who wants them. A group of volunteers through United Way was doing that for a period of 2 weeks every day. Also, tens of thousands of meals have been delivered between United Way, a lot of volunteers, and Nashua Transit, the bus service. Meals have been delivered to kids who need food and who normally get their meals, at least lunch and dinner, at school, and of course schools are closed. So I would like to turn it over to Bobby Bagley, who can give you some more details regarding the medical picture and the scientific picture, and I will come back then to talk about some of the details, a few of the details concerning our efforts to restart the economy.
Thank you, Mayor. Good afternoon, Nashua. And I want to thank you for your cooperation and all of the efforts that we've put forth to help stop COVID-19 from continually spreading in our community. I did want to talk about the continuation of our testing clinic in Nashua because testing is so important. The mayor talked about how we're seeing a decrease in our number of cases, how we're moving through these phases, how we've been able to successfully get through a number of incubation periods, and what that means is that for 14 days, we've seen a decline in our number of cases and our number of positives, not that they've stopped. We get daily updates from the state of New Hampshire on the number of cases throughout the state. And as we watch those numbers and as we pay attention to what's happening, we're seeing that we are having some declines that help us meet the gating criteria that's needed for us to continue to work on opening up our state and opening up the city. Testing is important because it allows for us to identify individuals in the community that may present with symptoms or without symptoms, but it allows for us to know what that picture looks like with regards to those numbers. We know that there continues to be community transmission, and again, that's why we continue with the testing. And during the week, the governor has opened up, and the Department of Health and Human Services and the commissioner has opened up testing for anyone who wants to be tested, because again, this gives us a good idea of what we're seeing in our state and in our community, and the impact that COVID-19 is having on us as we engage in opening up our businesses, our recreational activities, our faith-based communities and churches, opening beaches opening allows for us to allow for people to get tested so we can see the impact of those things. We do have clinics, and a clinic coming up this Thursday, which is tomorrow. That clinic will be open to the community at 50 West Hollis Street, which is over at the church, St. Louis de Gonza or St. Aloysius Church. And the testing will go from 3 to 6 p.m. We do ask that you still call. If you want to make an appointment for tomorrow's testing, call 589-3456 so that we can schedule that appointment for you. It's a drive-through and a walk-up clinic. Nashua has experienced has had the opportunity to offer testing for over a period of at least 4 to 5 weeks now. And in our testing, we've been able to see from the tests that we've had, about 5.2% positive results come back from that, again, matching that downward trajectory of positive cases. In New Hampshire, as the mayor said, between 6 and 7% is what we're seeing on average, but we see in Nashua about 5.2%. Because of what we've been seeing with regards to our testing, with regards to the results, with regards to the stabilization of the management and the capacity of our hospitals to maintain management of cases, our alternative care site that was set up early on in March, or late March, early April, will be dismantled as of June 19th. And this dismantling is occurring across the state because, again, New Hampshire has responded very well because of the mitigative efforts that have been put in place. We haven't experienced an overwhelming capacity of our hospitals not being able to manage the cases that have been hospitalized, that 10%. We have not had an overcapacity and overstretch of patients that have not been able to be managed effectively through our ICUs. We still, however, do have individuals that are on ventilators in both of the hospitals, and this is why our efforts of testing and our efforts of pushing out information regarding the importance of wearing our face masks for protection and reducing the spread of respiratory droplets to those in our community who are the most vulnerable. We're still seeing individuals having to be ventilated and being served in our ICUs, and that's why we continue with some of those measures. Our goal is to focus on the data because the data helps us tell the story of what we're seeing in our state. So collecting testing data, collecting percentages of positives, collecting information or hearing from our hospitals and what they're working with and how they're providing services is very, very important. So it's the data that we want to pay attention to. And yes, this is hard. And yes, it does seem like it's going on for a long time. That was intentional for us, again, in New Hampshire because we didn't want to have a huge spike early on that we could not manage. And so we ask that you continually work with us as we make it over the hill with this, our response with COVID-19. As things open up, it gives us the opportunity to come together as a community. We still need to practice social distancing. We still need to make sure that if we cannot be at least 6 feet apart from each other, that we wear our face covering so that we can protect each other from the spread of COVID-19. And I know people want to know dates. Well, when is this going to end? When will we stop having to have the mask ordinance or the face covering ordinance in place? As we continue to see the data show us that decrease, that's when we'll know that we can lighten up on some of the efforts that we have in place, because then we know that we've had an impact on stopping the spread of this infection. I just wanted to show this one way that we are tracking or monitoring our activities in New Hampshire. Our epidemiologist uses a Google mobility app that shows where people are and where they're gathering. And we can use this information if there is a spike up. So on one of the slides, the mayor showed you how we're having this downward trajectory, and as we continue through our phases to have those downward trajectories, that allows for us to know that we're moving at a good pace and we're doing well. This Google mobility app will allow us, if we were to have a spike up, for us to see where that spike could have occurred. And the work that we're doing with our contact tracing will allow for us also to be able to identify where that cluster or where that spike could have occurred. And on this slide, it just shows the percentage or decrease in activities and where people are actually gathered more closely together. So we can see that on some of the blue bars where there's an increase in activity, this is with the cell phones. You can see that there was, in April, a little bit of a bump up in the parks. And in May, you saw it went from 55% to 154% increase because things started to open up. You can see in residential in our homes, in March, in April, and May, that's the mid section of the slide here, where it went from 14 to 12 to 23% because a lot more people were staying at home. We can see on here where there was also the decrease in the retail, in transit or transit stations, and in our workplaces when things were shut down. So as things open up, we're going to see the changes in the Google mobility app of where people are and where we're starting to see some concentration of folks as we go back to work, as we engage in more going out into the retails and in our restaurants. This will also allow for us, when we're doing some of our tracking, to pinpoint where we're seeing these spikes, and will allow for us to know what are the things that we may have to retract on. So this is an important tool that we're using. We still continue with our public health recommendations. We still are going to push the message out of washing your hands, because we know that this is the tool, or this is the vehicle that the virus likes to jump on and go from person to person. We are still recommending, as hard as this may be, and as discouraging as it may be, and as disappointing as this may be for some, the wearing of the face coverings, because it does allow for us to come out and gather together. It does allow for people to go out and enjoy time at the restaurants, time in retail stores, without increasing exposure to ourselves and to our most vulnerable populations. We're also asking, the mayor went through the slides to show what happens in phase 1 and phase 2, and those most vulnerable populations, the things that they need to do to reduce their spread, to reduce their exposure to COVID-19, and that's, again, avoiding close contact. If it's not individuals that are in your household or in your family that you've been around, you want to make sure that you maintain that social distancing, because we are still seeing COVID spread. We are still seeing asymptomatic spread, or spread with individuals that have very mild symptoms. The changes that have happened with the recommendations, gatherings of over 10 people, it's there. We have vigils that are going on, in different parts of the country. We have visuals that are going on in our state where there are more than 10 people that are gathered together. If you participate in those gatherings, make sure, again, that you have your face coverings. Make sure that you are trying to maintain some sort of social distancing, because we are starting to have more people out in the community gathered together. Our goal, again, is to continue to flatten this curve out, to stop the spread of this disease, and it happens with us all working together. So we encourage, we implore you, we thank you for the efforts that you've put forth so far, and we ask for your continued patience as we come on the other side of this. Mayor? Thank you, Nashua.
Before we conclude, I wanted to talk with you about the efforts we're making to help our businesses recover, and help especially our small businesses recover, so that we can rebuild a strong economy at the other end of the COVID-19 virus. We know that many people have been hurt economically by the closures and the shutdown of the economy that has occurred over the last few months. In Nashua, more than 8,000 people who are employed in New Hampshire have filed unemployment claims. Some are back to work, but 8,000, that does not include anybody from Nashua who worked in Massachusetts who filed an unemployment claim, in other words, became unemployed down there. So we want to do everything we can here in our city to help our businesses recover. Small business sector employs many people. Small businesses have been most negatively affected by the steps that have been taken to close businesses temporarily and limit exposure. So I wanted to talk to you about some of the things that we're doing in the city to help our small businesses. First of all, downtown, the downtown area is where many small businesses are located. It's a congested area, a lot of restaurants and other service businesses there. The governor has authorized outdoor dining, nothing indoors yet, only takeout. So in order to help our restaurants and others get back on their feet, we wanted to take immediate action to expand the area of outdoor dining so they could have more customers seated outside in a safe way, so that they could resume business without having to use the inside of their restaurant spaces. So the Board of Aldermen, at the request of myself and our economic development team, in order to strengthen our downtown economy, authorize the closing of 2 lanes of Main Street, as well as reducing it to 2 travel lanes, as well as some of the parking spaces to allow tables to be moved into those spaces, restaurant tables. And if you've been down there, you've seen how that's been working. It has enabled the restaurants to serve many more people than they could just on the sidewalk, or obviously they can't serve them at all inside the restaurants. We have gotten very favorable reviews of the comments regarding these steps from almost everyone. Downtown businesses say it's helping them a lot. Also, people have commented that they like the feel of a narrower Main Street, a 2-lane street rather than a 4 or 5 lane wide highway kind of running through the middle of downtown. A lot of umbrellas are coming out, very lively, and a lot going on down there. Now, there is the requirement that these tables remain 8 feet apart. So that is important, because even though the businesses are beginning to reopen, we still want to maintain safety and social distancing. So as the slide up here suggests, the tables need to be 8 feet apart. And of course, we are following the guidance of industry-specific guidance and instructions that we are receiving from the state of New Hampshire. We do allow curbside pickup and limit and short-term parking right on Main Street, but we have configured things to make the downtown more business-friendly during this COVID-19 virus, especially small business friendly. And I just wanted to show you some of the things that have been done. This shows you the area near the river, Peddler's Daughter to the right, further down, Giant of Siam and other restaurants further to the left on the slide. The purple area is an area that has been closed and enclosed using barriers for seating. And you see that a number of areas in this section of Main Street have been cordoned off. The green areas are where people can pull in for short-term parking. If we go a little further down on Main Street, this shows you the intersection of West Pearl and Main Street. You can see that, again, the restaurants are being given, both on Main Street and on East Pearl, are being given space to open up, use tables, again, 8 feet apart. So, and then the third slide shows basically the same, a little further down on Main Street, I believe, or actually it's the same, I think it's the same slide, but you get the sense, and I suggest you go down and visit one of our restaurants. Again, be careful, wear your mask until you get seated, and then make sure the tables are 8 feet apart, but people are having it's very nice for people to be able to get out finally after all of the weeks and months indoors and at home. Also, before we conclude, I wanted to talk to you about the business at City Hall. Now, we have closed City Hall to the public since the middle of March. And the point here is to continue to prevent the spread of any COVID-19 from any city employees to members of the public, and vice versa, from members of the public to city employees. But people in City Hall are still working. They are doing many jobs they're doing the jobs that we need to get done to serve you, the residents of Nashua. For example, cars can still be registered, but under a slightly different system. If you have a car, meaning either remotely or there's a drop-off and pickup system that our city treasurer, David Fredette, and his staff have developed, the automobile registration staff. If you have a car to register, you go to the back of City Hall, or you call or email the automobile registration portion, the city treasurer's section of city government. You make arrangements, and then you can drop off your your paperwork and they will process it and then you can pick it up, or it can be done by mail. We are still doing code enforcement visits. Again, using masks and exercising caution, but we're still doing code inspections. We're still processing development. Anybody who wants to build a new business or anything like that, they're being definitely serviced. Building code people are working down there. Some other people are working remotely. People who are in finance and other things that are very data specific, they can work remotely. We've acquired new IT, new software to enable more remote working, but they are still working to serve you. And of course, you see in public works, we're still paving streets, we're still picking up garbage, we're still doing all the public works functions, the sewage treatment plant. And of course, our police and fire departments are still functioning at full capacity. Again, exercising precautions with masks and other protections, but still definitely serving the people of Nashua. So as we move into hopefully phase 2, discussed before, and we do a little more, we open a little bit more, we will continue to help our small businesses recover through the various steps that I've outlined. Also, we have a COVID-19 recovery fund, a small fund that we can use to make small loans to our businesses to help them stay on their feet during this troubled times. So we will be working hard not only to protect the people of the city, but also to help our businesses, particularly our small businesses, recover after the shutdown. Now, it's been very good to be with you again. We are giving a weekly update. I expect we'll be back next Wednesday. If you have comments or questions, please direct them either to the mayor's office or to public health. We'd be glad to help out in any way we can. So please stay healthy, be well, and God bless until next week.